I think, yes, there could have been, but honestly, because nobody had all the information about the pandemic, nobody understood how it worked, nobody understood how it spread, quickly. And so the drastic measures as recommended by the WHO in terms of the guidelines that were provided were followed, and social distance and border closures and all of that were part of that response. But having, by hindsight, now that we know when more details are showing up, now you could have seen that there could be more targeted closures or better risk targeting measures that could have been taken. People, instead of nationwide lockdown and complete shutdown of the economy, we could have just increased awareness, and then citizens would have known that if they take certain measures, they could avoid getting the virus. It would have also been good to just make PPEs available, right? Face mask and those kind of things that when people go out in public places, they could protect themselves and others around them. So those are the kind of things that could have happened, and it should have been a lot limited instead of the kind of impact we are getting now because of national lockdowns and closures. Generally, first, there will be a higher level of poverty. That's the first long-term impact. So right now, with over 400 million living below the dollar, daily, the dollar a day line. Now with this, you see a lot more people come down under that. We are looking at this, an estimate of say another 100 million might, get into that elevated poverty line. So that is one. But in terms of food insecurity and nutrition, this is the most important part, really. Because right now, because people didn't have access to food, what you get is that people began to adjust. Those who were eating 3 times a day are now eating twice a day. People are now resorting to begging. People are now resorting to stealing. Especially even in Lagos, for instance, in Nigeria, you saw a band of people coming out with cutlasses, with sticks, and they're trying to, find any way they can get food, getting into markets that have been locked up. The biggest challenge, the long-term impact of this is that many people are going to lose, their lives. Many people are losing their livelihoods. Those who had things in the market that were stored, that were robbed by a rampaging mob, are just going to suffer higher. And so we see those kind of long-term impact. But most importantly is that there is going to be just a higher level of poverty on the continent that we think will just take away all the progress that we have made in the past 25 years trying to cut down poverty. The most important context here is that Africa and Europe are neighbors, geographic neighbors. So whatever happens in Africa is bound to spill over into Europe. There's only so much of containment that you can have. But whatever happens in Europe as well is bound to spill over Africa. And this is one of the reasons we say we cannot defeat a disease anywhere unless we defeat it everywhere. So that is one. Now, in terms of the young people, they're very mobile, remember. So when the conditions in Africa become really unbearable, they will migrate to Europe. That is the reality. And as such, that's why in terms of the strategic long-term partnership and equal partnership we're talking about, there has to be a congruence in terms of the ideas that we put together. For instance, how do we prioritize health system strengthening? How do we improve the social welfare or social the social package in terms of people having access to social benefits, and palliatives and those kind of things. Because when lives are improved on the African continent, then it is less likely to affect, the neighbor in Europe. So there has to be a sitting down together, a co-creation where resources are deficient. The other partner can come in to say, let's try to help, because any fall out of that will affect the other continent. So that's how we see that a long-term, strong, equal partnership is really, really the key way to move forward, especially with the young people at the center of that.
Thank you so much, Edwin Ikhuoria, for sharing your expertise and opinions with us. Thank you.
Thank you very much. I'm really grateful for having me.